Well, thank you so much. This is truly my dream team here. I cannot tell you how appreciative I am for you guys being up here. And what is your favorite makeup for skin of color patients that matches the best?
Bobbi Brown is a friend, she's been a patient, so in full disclosure, I think they match really well. Like I have her concealer on under my eyes right now. I'm recommending more and more, this is not a makeup, but it goes to makeup, Latisse. And in a lot of my skin of color patients, they didn't have fabulous eyelashes to begin with, because so many of my patients are coming in with the eyelashes all the time, the eyelash extensions, the strip of eyelashes, and the glue will really damage. It causes kind of hyperpigmentation sometimes in skin of color patients. And backing up from makeup, I will tell them to use the Sente Dermal Repair. That product is fabulous for lightly moisturizing and evening out the skin tone.
Tell me, is mineral-based makeup still a thing?
What I found with the Jane Iredale and some of the powder minerals is when you're taking a picture, they're lighter. They reflect light too much. So I would actually put it on my patients. If it's too light, we have to go a little darker. So I tend to go a little bit darker when I'm using a powder mineral.
I see a fair amount of Asian patients, and they really like the Shiseido line. Yeah. So there's a lot of yellow undertones for that. And then I see a lot of surfers, including professional surfers, and there is this Shiseido sunblock. I am blanking on it, but it's their physical blocker that they swear by. And I've given them UV elements. I've given them physical. I've had them try some of the over-the-counter ones. It's the one that they always go back to and has like a cult following. But Makeup Forever, their face and body, which is a hydrogel-based foundation, is wonderful. You can layer it on very thinly, or you can actually add layers to give heavier coverage. And I love it. It looks like your own skin. It breathes. I break out a little bit more easily too. I've never had an issue with it, and they have all color tones as well.
Going to neck, what do you like, Amy, for neck products?
If you haven't seen me representing Definage, there's a reason for that, because I did 45-person double-blinded placebo-controlled study, and the question is, do you need a separate cream for your neck, or can you bring the creams that you use on your face down on your neck? Kind of a practical girl. I just is kind of like, do it here and then do it here. The drawback of that is that you run out of your stuff more frequently, but that's the way I like to do it. But there are patients who want something specifically for neck, and I do like the Nectaferm product.
I love the PCA retinol because it has a delivery system. Omnisomes are much more stable than liposomes, so they actually do get into the skin and deliver where they're supposed to. You can use them on the face and on the neck. I do think retinol is probably the most important ingredient we all should be using. I love Definage. On top of that,
I love Nectaferm, and they just came out with a new Nectaferm Advanced, which uses it's sort of harnessing microbiome technology, so that's one that I like a lot.
So in terms of what I think is hot, I really like the Lightera 2.0 for my practice. One thing that's sort of a cosmeceutical that I'm using more and more in my practice that I have on my own face this morning is the Strata Cell.
Because the price of prescription retinoids is so high right now, what I'm starting to do is basically to kind of like try to transition into more of the physician dispensed retinol products. And so micronized retinoids are something that is really, really fantastic.
I love the pigment eraser because it is an over-the-counter, non-steroidal form of Triluma with a 1% retinol, with 2% hydroquinone, and with inflation, which is a topical non-steroidal that is anti-inflammatory, so you don't need a hydrocortisone or cortisone-derived medication.
Can you share a little bit about what you feel about the current state of hair products with the audience?
When I switched to the Nutrafol in May of 2015, my hair's now 3 1/4 inches longer, and of course that's with frequent trimmings, and it's a lot thicker than it's ever been. So the Nutrafol is the one I sell in my practice, but Viviscal works well for some people, I must say. They have more studies, and Nutrafol has less studies, but it works well in other people.
Jeanine, can I ask you about traction alopecia?
Yeah.
Does it help for that, or does PRP help
So
for
it
that?
does. It does some. I don't do any PRP in my practice. I'm in New Jersey, and they're they would want their money back. To me, I need more clinical studies with PRP before I do it, but it does help to fill in with traction alopecia, depending on how bad the traction is, Jeanette. But if you have ophiasis, that's when you just have sheer, like shiny, like, you know, kind of like scarring, fibrosing hair loss in the front. It doesn't necessarily help with ophiasis. So it depends on how bad the traction alopecia is, and are they willing to change their hair care habits? Because if they're not willing to change and they're expecting miracles, tell them that you're not God.
Right, right. We can't forget that we're still doing hair transplant. So men and women. And I recently started working with Strat Pharma. They're 100% medical grade silicones that you can use immediately post-procedure. And they're the only silicones that you actually can use as a wound dressing.
You know, to me, this is, again, something that we wanted to do something where no slides, just discussion. It just makes it so much more interesting in so many ways.